It bears repeating that the VELscope VX is not a diagnostic test and does not, consequently, incur false positives. It is one component of the oral mucosal assessment process, and the final decision about whether disease or abnormality is present depends on the sum total assessment from data collected from patient history, palpation assessment, white light examination, and VELscope VX assessment. Document all findings, both normal and abnormal, in the patient's clinical record. Re-examine any suspicious regions under white light as follows. Re-evaluate the region under white light. Re-palpate the region. Identify any conditions that may have caused the region to appear dark under VELscope VX examination. Some conditions that may appear dark under VELscope include traumatic lesions such as chronic irritation from denture friction or cheek biting, pigmented lesions such as melanotic macule, common infections such as oral candidiasis and recurrent herpes, and inflammatory conditions such as aphthous ulcers, or vascular lesions such as varicosities, hematoma, or petechiae secondary to trauma. If after re-examination the cause of the lesion cannot be identified, observe the suspicious tissue through the VELscope handpiece while applying diascopic pressure. This is often referred to as blanching. Compress the lesion using a light amount of pressure in a sweeping motion with the back side of an explorer, dental mirror, flat instrument, or your finger. Fluorescence is typically lost in areas of inflammation. If fluorescence returns when you compress the tissue, there may be an inflammatory component to the lesion. It's important to note, however, that dysplasia can also be accompanied by inflammation. If a lesion does not completely blanch when compressed, heightened observation is warranted. If a suspicious area cannot be ruled out as a normal variant or otherwise benign, a follow-up visit for re-evaluation should be scheduled in approximately 2 weeks. The dentist should remove all potential etiological contributors in the area, such as trauma or infection. The intervention could be as simple as relieving a pressure point under a denture base, recontouring a sharp cusp, or treating for oral candidiasis. If the lesion has not resolved after the follow-up time, proceed with further investigation of the suspicious tissue according to your regular protocol. Your clinical judgment will ultimately determine the appropriate course of action. Persistent abnormal findings should never be ignored, and should be followed until they either resolve or their cause is well understood. Emphasize to the patient, however, that persistent abnormal findings do not necessarily indicate cancer. If the patient cannot make a follow-up appointment, or if the dentist feels that the patient is unreliable, immediate steps are advised. Remember, the gold standard for diagnosing precancerous and cancerous lesions in the soft tissues of the oral cavity is surgical biopsy. A biopsy that returns a result of dysplasia or any other pathology is a valuable finding, not a false positive. Discovering dysplasia early allows for the highest probability of a favorable treatment outcome. Dysplastic lesions, depending on the grade, have an increasing risk of progressing to cancer. Discovering them early allows for the highest probability of a favorable treatment outcome. Opinions differ on the treatment options for the various degrees of dysplasia, but it is generally accepted that detection is critical, as is regular follow-up. The role of the general dentist is to detect tissue variations, abnormalities, and frank pathology, and to establish the best diagnosis possible within the diagnostic processes they are using. The role of the RDH is to assist the dentist in that process by detecting suspicious tissue changes. The dentist-hygienist team can then decide next steps. Abnormal mucosa can be caused by a wide spectrum of conditions. Just the same, it is much better to err on the side of caution and sample suspect tissue than to ignore a potential disease process that could lead to oral cancer or another serious condition. Understanding the potential of the VELscope VX system adds significant clinical value to your practice, since the appropriate treatment of mucosal abnormalities, including cancer and precancer, can enhance care, add to the prestige of your practice, improve your patients' quality of life, or even save them from a potentially deadly disease.